Namaskar, good morning, respected Madam Sir and my dear classmate. I warmly welcome all of you to our research presentation. Today our research topic is assessment of knowledge of high risk pregnancy among third year students of Diploma in Nursing and BSc Nursing at Trauma Nursing College. This is our group research project under the Department of Diploma in Nursing, Science and Midwifery. My name is Shufala Gain and I am leading this team as the group member. At this point, I respectfully invite my group members to introduce themselves one after one.
Myself, Major Sanushna.
Assalamualaikum. My name is Brishti Akhtar.
Assalamualaikum. I am Nina.
Assalamualaikum. Myself, Abdul Welfare.
Assalamualaikum. My name is Kamrata Sumaya. Assalamualaikum. I am Shafa Jalta.
Assalamualaikum. Myself, Mustamad Bishti Khano.
নমস্কার, আমি তৃষা চাকমা।
Assalamualaikum. I am Maimun Khan.
আসসালামু আলাইকুম, লাবণী আক্তার।
Assalamualaikum. I am Mahir.
Assalamualaikum. It's me, Ajia.
In today's presentation, we will following the cover contents. Chapter 1, Introduction, including objective and variables. Chapter 2, Literature Review. Chapter 3, Methodology. Chapter 4, Result. Chapter 5, Discussion. Chapter 6, Conclusion. Chapter 7, Reference. And Chapter 8, Questionnaire. Now I am going to start the Chapter 1, Introduction part of our research. The World Health Organization (WHO) refers to maternal mortality as the death of a woman while pregnant or within 42 days after termination of pregnancy from any cause related to or aggravated by the pregnancy or its management. Pregnancy is a precious and vulnerable period requiring continuous antenatal care, early detection of difficulties and prompt treatment. Pregnancy-induced hypertension is a major obstetrical problem affecting millions. Preeclampsia and eclampsia are important components of pregnancy-induced hypertension and remain leading causes of maternal morbidity and mortality. Preeclampsia still accounts for about 15% of maternal deaths worldwide, with an estimated 50,000 maternal deaths per year. Women with preeclampsia are 3 to 4 times more likely to develop complications and have higher prenatal mortality. The incidence of preeclampsia is commonly 5 to 8%, while eclampsia accounts for 1.5 to 2% of pregnancies worldwide. The incidence is higher in low socioeconomic and rural areas. Effective antenatal care, early diagnosis, timely referral, and proper management can significantly reduce maternal and prenatal mortality. Now I invite the next presenter to continue the presentation.
Thank you, Shufala Gain, for your slide presentation. Assalamualaikum everyone. Myself, Major Sanushna. Today, talk to you about my slide. Objective. There are two types of objective: general objectives and specific objectives. General objectives: to assessment of knowledge of high-risk pregnancy among third-year students of Diploma in Nursing and BSc Nursing. Specific objectives: to explain the high-risk pregnancy, to find out the level of knowledge about signs symptoms of high-risk pregnancy, to assess the level of nurses' knowledge about the complication of high-risk pregnancy, to identify the nurses' knowledge regarding management of high-risk pregnancy, to explore the nurses' knowledge regarding causes of high-risk pregnancy, to assess the management skills of nurses on high-risk pregnancy, to find out the socio-demographic characteristics of the respondents. Thank you. Now I kindly invite the next presenter to take over.
Thanks to the previous presenter. Assalamualaikum. I am Mustamad Bishti Khano. Today I will talk about research variables. Please stay with me. Here is my slide. Socio-demographic variable, age, gender, religion, knowledge-related variable, concept of high-risk pregnancy, indication and contraindication of high-risk pregnancy, management of high-risk pregnancy, communication of high-risk pregnancy. Now I invite next presenter to come forward.
Thank you, previous presenter Bishti. Assalamu alaikum everyone. Myself Lavanya Nitu. Today's here my slide is chapter 2 review of literature. Pregnancy normally safe, but all pregnancies are carrying some risks. About 15% women develop serious complications needing skilled care, major risks, hemorrhage, infection, unsafe abortion, hypertension, disorder, preeclampsia, eclampsia, diabetes, cardiac disease, HIV. World Health Organization WHO 830 women die daily from pregnancy-related causes. Early detection of high-risk pregnancy through routine antenatal check-ups is essential to prevent maternal and neonatal complications. Antenatal women with the following conditions were categorized under high-risk pregnancy: severe anemia with hemoglobin level less than 7 gram per deciliter, hypertensive disorder in pregnancy, blood pressure greater than equal 140 over 90 milligram of mercury, pregnant women positive for HIV, syphilis, hypothyroidism, thyroid stimulating hormones values, first trimester 0.1 to 2.5 milli unit per international unit per liter. Second trimester 0.2 to 3 milli international unit per liter. Third trimester 0.3 to 3 milli international unit per liter. Gestational diabetes mellitus, oral glucose tolerance test greater than equal 140 milligram of deciliter. Thank you everyone for listening. Now I will invite our next participant.
Thank you, my previous presenter. Assalamu alaikum everyone. I am Maimun Nahar. Today I am going to giving a presentation about the topic of chapter 3 methodology. Type of study. Cross-sectional type of descriptive study. Place of study. Trauma Nursing College, Bitpur, Dhaka. Study population. Total 60 nursing students from Trauma Nursing College. Duration of study. The study was conducted from April to September. Place of data collection, Trauma Nursing College. Sample size, 60. Sample technique, purposes. Data collection instrument, structured questionnaire. Inclusion criteria. Third year student of Diploma in Nursing and BSc in Nursing student who are studying in Trauma Nursing College. Data collection method. At the beginning of data collection, permission from the principal. Questionnaire data was collected from that area. The purpose of the study was concerned authority of mentioned Trauma Nursing College. At the pre-testing was carried out at that location, which was helpful for finalizing the questionnaire. After finalization of explain in details to respondent. After the verbal con as per selection criteria of the study, data from the respondent were collected through face-to-face. Data analysis procedure, descriptive statistics. Thank you everyone. Now I kindly request my next presenter.
Thanks to my previous presenter for highly informative presentation. Assalamu alaikum everyone. I am Kamranahar Somaya. Today I am going to give a presentation about the topic of chapter 3 methodology part 2. Data presentation. Data presentation. The results are presented by using table and chart, pie chart with interpretation. Ethical consideration. It is essential for the investigator to obtain ethical approval from appropriate authority principle before embarking on data collection to assess the knowledge regarding prevalence of in the abortion and its associated factors among female students at Trauma Nursing College, Dhaka. The following ethical issues are considered before the study begins. Informed consent, participate, confidentiality and anonymity, voluntary participation. That's all from my side. Now I will invite my next presenter.
I appreciate the previous presenter for the well-structured presentation. Myself, Arjuna. Now I would like to present my slide, which is chapter 4 result on high-risk pregnancy. The result is based on two categories. One is socio-demographic based and other is knowledge related. Here are pie chart. Now I am brief about it. Socio-demographic information of the participated student nurses. Figure 1. Distribution of respondent by age. The pie chart shows that 46% age group of 22 years, 50% age group of 23 years and 3.3% age group of 24 years. Now I am moving to the next result. Distribution of respondent by gender. In this pie chart we can see 16.6% respondent of male within 60 students and 83.3% female respondents within 60 students. Now I would like to page about second part of result, which is information regarding nurses' knowledge and management. In this pie chart, we can see that 100% students knows about 12 means of high-risk pregnancy, 100% students knows about management and education, 98% students knows about investigation management, and lastly, 98% students knows about complication and prevention. Complication and prevention. 100% students knows about the means of high-risk pregnancy. 100. 100. সবাই জানে high-risk pregnancy আর 100% যারা আছে তারা ইনভেস্টিগেশন এবং এডুকেশন সম্পর্কে জানে। আর 98% যারা আছে তারা জানে ম্যানেজমেন্ট সম্পর্কে আর 98% যারা আছে তারা কমপ্লিকেশন এবং প্রিভেনশন সম্পর্কে জানে।
আচ্ছা বিএসসি থার্ড ইয়ারে যে স্টুডেন্ট কি আপনাদের ম্যানেজমেন্ট 98% জানে বিএসসি টা ফোর্থ ইয়ারে দিয়ে
To keep the flow moving, I request the next presenter to come ahead. To come ahead and lead the next part. Thanks to my previous presenter. Namaskar everyone. Thank you for joining us today. I am Trisha Chakma. Now I will be discussing the discussions of chapter 5. This cross-sectional type of descriptive study proved a wide range of information on assessment. Results show that the majority of student nurses, respondents 66.67%, having diploma in nursing, 33.33% have BSc in nursing.
Thanks to my previous presenter. Assalamu alaikum everyone. Myself, MD Rubel Mia. Now I talk about this slide, chapter 6, conclusion. The result of studies show that nursing students have moderate to adequate knowledge regarding high-risk pregnancy. Although some gaps were identified in specific areas such as risk factors, warning sign and management principles. Strengthening theoretical technique along with skill-based clinical demonstrations may further improve their understanding. The finding of this study may be useful for planning educational interventions, revising curriculum content, and arranging training sessions to enhance students' knowledge regarding high-risk pregnancy. The major limitation of the study was its small sample size and limited time, which may restrict the generalization of the finding. Thank you everyone for listening.
This slide shows the reference we used for our study. We mainly collected information from midwifery textbook, WHO reports, and different research journals. These slides presents our questionnaire. It had 3 sections: general information, socio-demographic details, and knowledge-related questions. না আমাদের টোটাল 16টা কোশ্চেন।
বাংলায় ছিল তো
বাংলাতে না সব ইংলিশে।
বাংলা মাস কি করবো ইংলিশে থাকুক না থাকুক বাংলা মাস কি করতে কিন্তু আমাদের দেশ বাংলাদেশ
Explain the high-risk pregnancy to find out the level of knowledge about signs symptoms of high-risk pregnancy. To assess the level of nurses' knowledge about the complications of high-risk pregnancy. To identify the nurses' knowledge regarding management of high-risk pregnancy.
To identify the nurses' knowledge. রিসার্চ করতে কি স্টুডেন্ট নার্স বা নার্সিং স্টুডেন্ট তাহলে আইডেন্টিফাই দ্য নার্সেস নলেজ টু আইডেন্টিফাই দ্য নার্সিং স্টুডেন্টস নলেজ রিগার্ডিং ম্যানেজমেন্ট অফ হাই রিস্ক ঠিক আছে সবগুলাই ওই একই ভাবে আসছে মানে অন্য ভাবে কপি করা হলো
তো কোপার চেক তো আমরা জানি
অসুবিধা নেই
আচ্ছা এই স্লাইডে আমার একটু কোশ্চেন আছে আগের স্লাইডে কি জানবেন আনসার হ্যাঁ না পরেরটা
যদি অবজেক্টিভ
আচ্ছা এইখানে যে WHO থেকে তোমরা নিয়েছো যে 830 জন women প্রতিদিন মারা যাচ্ছে প্রেগন্যান্সি রিলেটেড কজে তো এটা WHO লাস্ট কোন সালের রিসার্চ থেকে নিয়েছো তোমরা
এটা 2007 সালে
2007 সালের পরে আরো নিজস্ব রিসার্চ হয়েছে লেটেস্টটা দিতে হয় সব সময় এবং সেটা উল্লেখ করে দিতে হবে কোন সাল থেকে তুমি সেটা নিয়েছো ওইটা তো আমরা বানাতে পারবো না যে কোনো অর্গানাইজেশন WHO ইউনেস্কো যেটা ডিক্লেয়ার করবে তাহলে তারা ওটা রিসার্চ করছে তো এটা লেটেস্ট যে সাল থেকে স্টাডিটা করতেছে ওখান থেকে নিতে হবে আর এই স্লাইডে থাকে আরেকটা যেটা আমার কাছে একদম ইনকমপ্লিট লাগছে কজেস অফ তোমার হাই রিস্ক প্রেগন্যান্সি কজগুলা তোমরা প্রায় 4-5টা ইম্পর্টেন্ট কজ এখানে দাওই নাই বাদ দিয়ে দিছো যেরকম তোমার এইজ একটা এখানে বড় কজ যেরকম তোমার যদি এলডারলি প্রাইমেট ঠিক আছে 35 ইয়ার্স এর পরে প্রেগন্যান্সি একটা হাই রিস্ক আবার কি আর্লি প্রেগন্যান্ট গ্র্যাভিটা হ্যাঁ বয়স যদি 18 নিচে 20 আর কম হয় এছাড়া তোমার প্রিভিয়াস যদি ওর অ্যাবর্শনের হিস্ট্রি থাকে একটোপিক প্রেগন্যান্সি হিস্ট্রি থাকে বা মানে মাল্টিপল বার্থ লসের হিস্ট্রি থাকে তাহলে ওই প্রেগন্যান্সিটাও আমরা কিন্তু হাই রিস্ক বলবো এইগুলো কিন্তু তোমরা অ্যাড করো না তারপরে প্রেগন্যান্সি উইথ হার্ট ডিজিজ লিভার ডিজিজ ক্যান্সারের পেশেন্ট থাকে না প্রেগন্যান্সিতে তো এগুলা অ্যাড করতে হবে
আমরা বইয়ে আর কি ডিটেইলসে করেছি বাট এখানে আমরা স্লাইডগুলো মানে মেইন টপিকগুলো আমরা এখানে তুলে ধরেছি
না এগুলো মেইন ওইখান থেকে মাল্টিপল প্রেগন্যান্সি ট্রিপলেট কোয়াড্রিটিউটেড এই